Hello, I'm Donna Williams from the Breathe programme. Today we're going to talk about mental health and chronic respiratory disease. Managing daily activities and mental health. Mental health is not isolated to any particular group of people. It's estimated 1 in 4 people will be affected in their lifetime. The risk of stress, anxiety or depression has been recognised that those living with chronic respiratory disease can be affected in higher levels. It's important to recognise that it can be a normal response to living with a long-term condition. Most importantly, know that you are not alone. Recognising symptoms of anxiety and depression. Anger, feeling on edge, feeling disengaged, having difficulty sleeping, feeling lethargic, experiencing panic attacks, feeling hopeless and restless and irritable, having a churning stomach. It's very common to have symptoms of anxiety and depression at the same time. You can self-assess or monitor your own mental health by using the NHS Mood Assessment Quiz via the NHS website. Alternatively, discuss with the Breathe programme team the results of the mood questionnaire you completed upon assessment. How might this affect me? Having 1 or more long-term physical conditions increases the likelihood more than twice of developing anxiety and depression. Your breathing problems may have stopped you from working, doing what you love, or what you have plans to do. Not achieving a good night's sleep and feeling tired can lead to a loss of interest in all activities. You may feel frustrated when you aren't able to do your everyday tasks. It may be stressful needing regular appointments, tests, treatments, or needing support from others. Uncertainty around your future and progression of your lung condition. Breathlessness can feel very frightening and trigger anxiety. Loneliness and isolation. Anyone can be lonely or socially isolated. Loneliness doesn't always mean you are alone. This may be the case, but it also relates to the quality of your relationships. Being socially isolated is more related to the number of contacts you have. Everyone has different social needs, and being socially isolated is when you have less contacts than what you personally require to feel healthy. Managing daily activities and mental health. It is common to find people with chronic respiratory disease who are reluctant to leave their home or engage in activities. This may be due to the symptoms, protecting themselves from infections, feelings towards their physical capabilities, or feeling embarrassed in social situations. It can also be hard to engage in activities that you've done previously and to notice the changes that come with your lung condition. You may feel that you have no one to talk to about how you feel, or anyone that understands what it's like to live with your condition. Loneliness and social isolation are not mental health conditions. However, they are significant contributors to anxiety and depression. Avoidance behaviour. We may have difficulty with activities in our daily life, which can lead to worrying thoughts. I'm out of breath. It must be dangerous. Physical symptoms of breathlessness. For example, finding it hard to recover your breath. We may then avoid everyday tasks which causes breathlessness. For example, stairs or walking. we may choose to sit down and do nothing instead. This will give us a short-term relief because we're not active, we're not causing breathlessness, but the long-term effects could be a lack of fitness and strength, which in turn can increase our breathlessness. It can reduce our confidence and cause anxiety and depression. Breathlessness and anxiety. Feeling like you can't catch your breath can be very frightening. Unfortunately, it's easy to fall into a vicious cycle of breathlessness and anxiety. Our bodies perceive breathlessness as a threat, which then triggers the fight or flight response. Stress, activity, or illness can cause shortness of breath, which then can make us feel anxious. We may feel our heart beating faster. We may notice we are breathing faster, more deeply. We may feel unable to catch our breath, which causes us to feel panicky. This reaction is not dangerous. It's a result of an increased adrenaline designed to help us out of potentially harmful situations. However, when triggered by breathlessness and left to escalate, it's not helpful and can make you feel unwell, but it can be controlled. Learning about your lung condition and how to manage your symptoms and prevent or manage exacerbations, also known as a flare-up of your chest condition. Ask your GP or practice nurse or pharmacist to refer you to the Breathe programme. Make sure you attend regular health checks at your GP practice, where you can discuss your chest symptoms and how you feel your inhalers are working for you. Have an inhaler technique check and keep up to date with your vaccinations. Avoid smoking, alcohol and drugs. These props in life may make us feel as though they're helping us cope with our other long-term health conditions, but they bring about side effects and symptoms of their own and can lead to developing more long-term health conditions. Keeping active and eating a healthy diet. We're now going to talk about planning and pacing and energy conservation. We will also practice a relaxation technique. What can I do to manage my mental health? Planning events or appointments for times that are best for you. Leaving time for taking your inhalers and medications and clearing your chest in the morning. If tiredness is something that affects you later in the day, try not to plan things for this time. Pacing. It's common for people living with chronic respiratory disease to rush activities that they find difficult, to try and get it over and done with. By using pacing techniques on stairs and slopes, stopping for a rest before becoming breathless, you'll find you're likely to manage and do more when working at a slower pace. What can I do to manage my mental health? The importance of developing relaxation techniques. Relaxation benefits us physically by lowering our blood pressure, our heart rate, aids our digestion, and increases sleep quality. Research shows that relaxation reduces stress and muscle tension, helping us to avoid anxiety and depression. Relaxation can also improve brain function and memory. Examples of relaxation are music, the arts, nature, board games, quizzes, reading, Tai Chi, yoga. Active relaxation, relaxed breathing, and tense and release muscle technique. Spend at least 10 to 15 minutes a day changing the focus to yourself. During your chosen relaxation, be mindful of the present, what you're doing, why you're doing it, and how it's making you feel. What can I do to manage my mental health? Relax breathing. Take 15 minutes a day to yourself without distractions. Play some calming music or enjoy the quietness and practice breathing control. To do this, get yourself in a comfortable, supported position with nothing tight around your stomach or your chest area. Relax your shoulders and your arms and hands. Have both feet flat on the floor, palms facing upwards. Breathe in gently through your nose, feeling your stomach rise, and breathe out through your nose or mouth slowly. Try to feel more relaxed each time you breathe out. Notice your breathing slowing down. Notice breathing in a little deeper. Notice your body relaxing. Be mindful of the here and now and how feeling relaxed feels to you. What can I do to manage my mental health? The 5 ways to well-being were created using the most recent evidence in order to build 5 vital actions that improve our mental well-being into our lives. These are: connect. Having good relationships are important. They build a sense of worth and belonging. Being active improves our physical health and self-esteem and can prevent age-related cognitive decline. Taking notice. Mindfulness can help you understand yourself better. Positively change the way you feel about life and how you face challenges. Learning new skills can incorporate connection and also give you a sense of purpose. Giving to others also links with connection alongside providing a sense of reward and positivity. It's crucial to utilise the support that's available to us. Everyone's mental health and their journeys are different. Therefore, mental health support is not a one-size-fits-all approach. This support comes in various settings and forms. Friends and family can be a great support. The Breathe team can help with any referral to external providers. For example, befriending services through Age UK, Citizens Advice or other organisations, or accessing support groups specific to mental health or chronic respiratory diseases. Taking part in activities or social groups in person or online can help refocus. Talk to your GP if you feel your mental health has been affected so you can discuss potential treatment options.